Burns. A burn causes the partial or complete destruction of skin. There are two layers of skin. Once the skin is burnt, the extent of damage can be minimised by effective immediate first aid treatment. Around the burn area, there will be pain, localised blistering, red to black marks. Evidence of inhalation burns may include burns to the face, nasal hairs, eyebrows, or blackness around the nose and mouth, coughing, hoarse voice, and breathing difficulty. Types of burns can include thermal, inhalation, scald, electrical, chemical, phosphorus, acid, petrol, radiation, and friction. For all burns, the aim is to stop the burning process, cool the burn, and cover the burn. Cool with lots of tap water for at least 20 minutes. If water is not available, hydrogel products may be used. If possible, remove all rings and tight clothing before swelling occurs. Do not peel off clothing which has been stuck to the burn area. Cover the burn area with a loose and light non-stick dressing. If waiting for the ambulance, keep the casualty at rest, warm, and monitor. Choking. Foreign body airway obstruction or choking may be partial or complete and may be present in the conscious or unconscious casualty. They may have extreme anxiety and agitation, making gasping sounds. They may be coughing or cannot speak. They will usually be holding their hands up to their throat, which is recognised as the universal choking sign. In these situations, give 5 back blows with the heel of your hand into the middle of their back. For a baby, place them over your lap or arm with the head down. Then give 5 chest thrusts. Turn a baby over and across your thigh. Repeat this sequence until the object is dislodged. Call an ambulance immediately for complete obstruction. If possible, ask others to do it. Crush injury. A variety of situations can cause a crush injury, such as vehicle entrapment, falling debris, industrial accident, mining accidents, and cave-ins. Possible injuries may include lacerations, fractures, bleeding, bruising, spinal injury, and in severe cases where a large portion of the body is crushed. For small injuries such as crushing a finger in a car door, run under cold water and apply ice packs to reduce swelling and bruising. Bandage or cover wound or split skin. See a doctor if stitching is required or the injury does not get better. For large injuries, call an ambulance. If it is safe and physically possible, all crushing forces should be removed from the casualty as soon as possible. Control any bleeding, keep the casualty warm and still. Ear injuries. Ear injuries can be caused by foreign objects, trauma, ruptured eardrum, and even illness. Dependent on the injury, symptoms may include feeling sick or dizzy and have a fever. There may be obvious bleeding, bruising, swelling, or redness. For these situations, you should seek medical assistance. Do not block any drainage coming from the ear. Do not try to clean or wash the inside of the ear canal, and do not put any liquid into the ear. Electrical shock. For these incidents, ensure that all bystanders remain at least 10 metres clear of any electrified material. Do not touch the casualty or any conducting material touching them until the supply of electricity is turned off and, if possible, the appliance is unplugged from the power supply. First aid should only be provided if it is certain that it is safe to do so. Call an ambulance and keep bystanders back. Treat any other injuries that may be present and use cold water at any entry or exit wounds and burns. Eye injuries. The eye can be injured by a chemical, foreign object or direct blow. There will usually be pain and redness associated with an eye injury. There may also be bleeding, tearing, sensitivity to light, swelling and/or discoloration. There are a few different types of first aid treatment for eye injuries. Black eye. Cold compress, ice pack wrapped in thin towel or ice cubes tied in a cloth. Do not attempt to remove contact lenses. Medical professionals will do this. A black eye or blurred vision can be the sign of damage inside the eye. Minor foreign objects. Never use sharp objects such as tweezers to try and remove foreign bodies. Floating objects in the eye which can be visualised may be flushed from the eye with water or saline. Major foreign objects. To be removed by professionals only. Call an ambulance.